Yes.
Yes.
All right, thank you. So we're going to go on the record now. So for the record, my name is Ricardo Arroyo, Boston City Councilor for District 5. I'm the chair of the Boston City Council Committee on Public Health. I'm joined by my colleagues, Councilor Ed Flynn, Councilor Erin Murphy, and Councilor Kenzie Bach. This public hearing is being recorded and live streamed at boston.gov/City Council TV. It'll be rebroadcast on Xfinity Channel 8, RCN Channel 82, Verizon Fios Channel 964. We will take public testimony at the end of this hearing. If you wish to testify via video conference, please email shane.pack@boston.gov to sign up. When you are called, please state your name and affiliation or residence. Limit your comments to no more than 2 minutes to ensure that all comments can be heard. You may also submit written testimony by emailing ccc.health@boston.gov. Today's hearing is on two dockets. Docket 0192, message in order authorizing the City of Boston to accept and expend the amount of $691,110 in the form of a grant for the COVID-19 response grant awarded by the Center for Tech and Civic Life to be administered by the Election Department. The grant funded planning and operating a safe and secure election administration in the City of Boston for the 2020 election. Docket number 0547 is a message in order authorizing the City of Boston to accept and expend reimbursements in the amount of up to $6 million from the Federal Emergency Management Agency, or FEMA, and the Commonwealth of Massachusetts for expenses related to the COVID-19 event. Our expected panelists today are three folks: James Williamson, the Deputy Director Budget, Office of Budget Management; Anita Tavares, who's the Boston Elections Department Commissioner; and Sabino Piemonte, who is the Boston Elections Department Manager and Head Assistant Registrar. I also want to note that we've been joined by Councilor Anissa Savi-George. Because these are grants, I'm going to go directly into the panel, and then I will open it up for questions in order of arrival. And so let's deal with the first docket, which is docket 0192. This is a message in order authorizing the City of Boston to accept and expend $691,110 for the COVID-19 response grant, which has gone to the Election Department. And I believe, I don't know if all three panelists are here to speak on that or just Anita. And actually, I'm seeing that Sabino Piemonte is not here, so.
Good morning. I believe it is just myself. I'm Anita Tavares, as you mentioned. So in 2020, as you all know, there were a lot of temporary measures in response to COVID to expand voter access and provide for safe voting. So we were presented with this opportunity to apply for this grant, which we did. And I will say that the funds for this grant have already been expended. So they went towards things like emergency personnel. We, due to the expansion of vote by mail, the temporary legislation to allow for vote by mail, we saw a huge increase in voters requesting vote by mail ballots. We had to bring in a large number of seasonal hires in order to manage the volume. So that was one of the areas the expense went towards. It went towards the overtime costs and a lot of printing so that we can advertise COVID signs and how to properly wear face masks, directional signs, early voting flyers, promoting early voting, especially for the September election, which we did not budget for. That was something that was kind of just thrust upon us. So a lot of the costs went towards managing the September primary and actually advertising early voting for the September primary, COVID signage, and all of the seasonal hires as well.
Thank you. And so this is money already spent. This is reimbursement money?
This money has already been spent. It's already been expended. But I was told just as a formality that we needed to have this hearing just to kind of approve the grant.
Okay. And so with that, I'm going to go ahead and I'll save my questions for last. Does any, we'll go in order of arrival for this. Councilor Flynn, I believe you're first up.
Thank you, Councilor Royal. Thank you, Commissioner Tavares. Thank you to the professional work of the Election Department. I don't have any questions, Councilor Arroyo.
Thank you. And actually, just to make this first round easier, If anybody does have any questions specifically about docket 0192, which is the money expended for the elections, if you could just raise your hand, either virtually or, turn your camera. There we go. Councilor Bach.
Thanks so much, Councilor Arroyo. Obviously, Commissioner, money already spent, so I don't think it makes a ton of sense for us to grill you about it. But I was just wondering, do you guys feel as though now you've sort of gotten a sense of what the kind of permanent expanded operational costs are of operating? Like, because as you said, I think we didn't necessarily anticipate, because we aren't required to have the early voting for the September prelim, but we ended up doing it, whatever. So it wasn't sort of factored in. But I'm just wondering if going forward, you guys sort of feel like you have a budgetary sense of the new normal, or if you're still figuring that out.
Absolutely. However, we do not know what the new normal is, because vote by mail is not yet a permanent measure. So should it become a permanent measure, yes, we would definitely have a much better sense on the budget and what the costs will be.
Great. And obviously, I think, like, I mean, I know that it's not permanently extended, but hope that we can budget in the city of Boston in the year ahead as though it is going to be, because I know we would all be very disappointed if it's not. Mr. Chair, that's my only question on this.
Thank you, Councilor Bach. And I see no other hands, and so we're going to move on to the next docket. Mr. Tavares, you can log off and head off. Docket 0547 is a message and order authorizing the city of Boston to accept and expend reimbursements in the amount of up to $6 million from the Federal Emergency Management Agency, or FEMA, and the Commonwealth of Massachusetts for expenses related to the COVID-19 event. And to speak on behalf of that, it's your full name is James Williamson, but do you prefer Jim?
Yes, please.
Yes, Jim Williamson. And so with that, I hand the floor to you, Mr. Williamson.
Thank you. Good morning, Chair Arroyo and the other members of the Boston City Council. I want to thank you, the City Council, for having this public hearing. I'm here to testify on docket 0547, a grant authorization to accept federal reimbursement from FEMA, managed by MEMA, the state equivalent, to reimburse city costs related to emergency response to the COVID-19 public health emergency. So I thought I did share this information yesterday, but just to go over sort of the chronology of events, that sort of, as we all know, in March 2020, a national emergency was declared. As part of that, the city's emergency response sort of geared right up, knowing that federal reimbursement was in the offing. In June 2020, the Boston City Council approved its first $10 million appropriation or grant acceptance to start this work. This has been a very intense process with lots of different resources coming into the play. And also FEMA has changed its rules a little bit. So in August 2021, FEMA changed the typical cost sharing arrangement. It historically has always been a 75-25 split. And they increased that participation to 100%. And they also, at that same time, made it retroactive to capture costs all the way back to January 2020. And this is a national event, so it's for community, state, and local governments across the country. And most recently, in November, the period of 100% reimbursement was actually extended out to April. So that's good news to us. So now we're before you. We have an additional $6 million appropriation grant acceptance for FEMA dollars. And just to give you some context on what's been happening to date, it's a lot of this similar to the activity discussed in the election department. A lot of this work, the bulk of the work has taken place so far, but reimbursements that we've received to date from the Commonwealth, through the Commonwealth from federal resources, there was like $4.8 million that have been received for emergency feeding, $2.3 million for the emergency overflow hospital, the homeless bed component of that, $1.1 million for emergency sheltering, Another $1 million has been received for the emergency response consulting that sort of stood up the day-to-day emergency calls and operations. And then lastly, just what's been reimbursed to date is $300,000 for communications and information packs and things of that nature that were distributed during the height of the pandemic. And so what we anticipate, this order will help support receiving additional claims that are ongoing in the range of $4.5 to $5 million for additional emergency feeding, personal reimbursement for personal protective equipment, cleaning, sheltering, and then finally we're going to try to capture our administrative costs associated with managing this claim. And just also as additional context, because there are lots of resources that are coming into play, FEMA eligibility criteria is for emergency protective measures to save lives, protect public health and safety. It's not for things for increased costs associated with operating, such as the costs associated with orchestrating remote work or distance learning and those types of things. Those are not sort of FEMA eligible costs. But specific eligibility details were continually refined over the course of the pandemic, from March 2020, September 2020, January 2021, and August 2021. So, and with that, well, this $6 million should capture everything that we have underway, and it's not to say that we might not need to come back again if this event continues and eligible costs continue to be borne by the city. And with that, happy to take any questions you guys might have.
So I'm going to start. Thank you for that, Mr. Williamson. I'm going to start in order of arrival again. This one's for reimbursements up to, I believe we've done $6 million in reimbursements on this one. So Councillor Flynn.
Good morning, Councillor Arroyo. I have no questions or comments.
Thank you. Councillor, I believe next one is Councillor Murphy.
Good morning. Thank you, Councillor Arroyo, and thank you, Mr. Williamson. I have no questions either. Thank you.
Thank you. Councillor Bach.
Thank you, Mr. Chair. Jim, sorry, did you make a reference to something you sent over yesterday? I think I might not have it.
I think I worked through IGR. I think it was sent out to the chair, just sort of a summary. I can certainly forward it to you.
Shane, did we and thank you again to our central staff for putting this together, but Shane, is that something that's been emailed out?
Hi, Mr. Chair. I'm looking through my email right now, and it looks like I haven't received anything through IGR.
All right,
I can reshare it. I believe I already shared with Yasmin. Apologies on that.
Yeah, so it's on the way now.
Great. So I'd love to just look that over. So I might have another question or two, Mr. Chairman. But Jim, just sorry, can you just go back from the beginning again? How much in total FEMA reimbursements have we gotten through this program?
We've already received $9.5 million.
Right. And then this is another 6.
Correct.
And sorry, I don't have the order in front of me. Or have they in fact issued us the $6 million reimbursement and we're just accepting and expending, or?
We have started the process. It's a fairly lengthy process to get reimbursement through. In fact, the Commonwealth has retained a consultant to help filter out and help, determine, work with communities on the eligibility criteria. So we have basically additional, roughly in the $6 million range worth of projects in motion in various stages of documentation is fairly significant associated with a FEMA claim.
Right. No, and I'm aware of that. I guess I was just clarifying. So in their process, you require council action before they've actually authorized the reimbursement to us?
I don't think we have to due to the emergency nature of it. This is just basically to formally allow us to sort of, take in the revenue. But
Right.
I think these are reimbursements, so sometimes the activity is, things that may be, expenses that have accrued on like a different budget, say like the overtime costs or things like that.
Right. I'm just trying to understand whether FEMA has promised us the 6 yet or not.
I think we have a fairly good assurance that we'll have at least $4.5 to $5 million in reimbursement. It's just working its way through the process.
Got it. And you think that, I mean, I guess I had hoped when it went to the 100% reimbursement, like we would be able to fold more activity under this and maybe drive that number up a bit. What do you think the prospects for that are?
Well, I think we try to pursue everything we think is a good eligible. We, obviously working through the Commonwealth's consultant, there's been things where they've said, no, this doesn't seem like, and we're also, balancing this with other resources we have to try to maximize. But I think this $16 million, is a good effort to maximize our revenue for the emergency response.
Mm-hmm. Okay. Yeah, no, I had thought when they made that change, like it might open up for some more, just thinking about the sheer scale of monies that the city has spent on COVID related items and understanding that they draw that, fairly narrowly, but even so.
One point of clarification, Councilor, is that the Public Health Commissioner has their own independent course of FEMA claiming. So there are a lot of costs being captured through the Public Health Commission, who is claiming directly.
Is that something that you could get for the council? What the sort of where the FEMA claims stand on the public health side?
Sure.
That would just be helpful to understand, kind of, because again, my gut is just that it should be higher, knowing what the eligible expenses are, but it may be that a lot of it, like you say, is on that side of the ledger.
Right.
Great. Okay, and I mean, I guess the other question would just be to say that, in the conversations with the Commonwealth sort of adjuster consultant, obviously, if there are places where on the city political side we need to advocate, I wouldn't want us to be artificially constrained based on the Commonwealth's interpretation of the federal rules if it's, not necessarily correct.
Thank you, Councilor.
But thank you, Mr. Chair. I think those are my questions for now. I'll just glance at the document when I get it.
Just waiting on the document to show up. I think it's been sent over to Shane now and should be in our inboxes soon.
Mr. Chair, yes, I just received it. I'm going to be blasting it out right now.
Thank you so much. Councilor Isabi George.
I don't have any questions this morning. Thank you, Mr. Chair.
Thank you. And I don't have any questions either, but I want to make sure that Councilor Bach is able to ask her questions once this document comes out, if you don't mind waiting just a moment, Ms. Williamson.
Yeah, I think I'm good, Mr. Chair. Mr. Williamson, just you said that the period's been extended to next April.
For the 100% reimbursement component is through April 2022.
So that document should be in your inbox now. It's just 3 pages of slides, 2 really. So it should be pretty quick to glance over.
And Mr. I just looked at it. And Mr. Williamson, I mean, I guess I would just urge us, I think unfortunately, right, we've got another wave of COVID hitting. Obviously, the mayor announced some measures yesterday. It feels like the city should certainly be looking at this as an opportunity to maximize resources with, ongoing new things that we might do in the next few months in relationship to the ongoing COVID threat. I assume that you and your office are sort of looking actively at how to maximize that.
Absolutely, Councilor, yes.
Thank you, Mr. Chairman. Those are all my questions.
Thank you. And with that, I'm going to adjourn this hearing. Thank you to all of you for attending. And thank you, Ms. Williamson, for your patience and for answering those questions.
Thank you.
Thank you, everyone.